Have you ever wondered if there's a natural way to improve diabetes control and avoid dangerous complications? If you or someone you know is dealing with this condition, know that certain vitamins can be essential for keeping glucose levels in check, reducing inflammation, and protecting the body from damage caused by excess blood sugar. Diabetes is one of the most common chronic diseases in the world, affecting millions of people. The biggest challenge for those living with this condition is controlling blood sugar and preventing complications that can impact the heart, nerves, kidneys, and even vision. While medications and dietary changes are fundamental, few people realize that some vitamins can make all the difference in managing diabetes. In this video, you'll discover the 3 key vitamins every diabetic needs to take to improve glycemic control and prevent serious issues like neuropathy, cardiovascular diseases, and cognitive decline. But that's not all. In addition to these 3 essential vitamins, we'll also reveal other highly important supplements and nutrients that can transform your health and help you live better with diabetes. If you've tried various strategies to keep your glucose balanced and still face difficulties, it might be that a deficiency in just one vitamin is sabotaging your efforts. Often, a simple supplement can protect your nerves from diabetic neuropathy and enhance your body's response to insulin. So, if you want to know what these vitamins are and how to incorporate them into your routine, watch the video until the end. You might be surprised by the impact these substances can have on your health. Let's get straight to the point. The first essential vitamin for diabetics is vitamin C. You may have heard of it as a powerful antioxidant and a great ally for the immune system, but its benefits go far beyond that. Vitamin C is crucial for people with diabetes because it directly reduces chronic inflammation, one of the major villains of this disease. Excess glucose in the blood causes damage to cells and blood vessels, leading to serious complications like cardiovascular diseases and circulatory problems. Vitamin C helps neutralize this damage, protecting the body from oxidative stress caused by high sugar levels. Plus, this vitamin improves blood circulation. Many people with diabetes struggle with circulation issues, which can result in cold feet, slow healing, and even wounds that take a long time to close. Vitamin C aids in collagen production, an essential component for the integrity of blood vessels. This means that by consuming vitamin C regularly, you're strengthening your circulatory system and reducing the risk of problems like diabetic ulcers. Another key benefit of vitamin C is its influence on insulin sensitivity. Studies suggest that this vitamin can help improve glucose uptake by cells, naturally lowering blood sugar levels. This effect happens because vitamin C fights free radicals, which can interfere with insulin's proper functioning. If you want to reap these benefits, include vitamin C-rich foods in your daily diet, such as oranges, acerola, strawberries, kiwi, bell peppers, broccoli, and kale. For those who struggle to eat these foods regularly, supplementation might be an interesting option, but always under the guidance of a doctor or nutritionist. Now let's move on to the second essential vitamin for diabetics, vitamin D. Typically associated with bone health, this vitamin has an even greater impact on glucose regulation. Studies show that vitamin D deficiency is directly linked to insulin resistance, one of the biggest challenges for people with type 2 diabetes. This happens because vitamin D influences pancreatic function, aiding in insulin production and release. When levels of this vitamin are low, the body struggles more to control blood sugar levels, increasing the risk of hyperglycemia. Additionally, vitamin D plays a critical role in reducing chronic inflammation. Many people with diabetes experience constant inflammation in their bodies, which worsens the disease's symptoms and heightens the risk of cardiovascular complications. Acting as an immune system modulator, vitamin D helps reduce this inflammation and balances bodily functions. Another vital aspect of vitamin D is its impact on bone health. Diabetes can increase the risk of osteoporosis and fractures, especially in older individuals. Vitamin D is essential for calcium absorption, ensuring stronger bones and preventing structural issues. It also contributes to muscle strength, reducing the risk of falls, something especially important for those with diabetic neuropathy. The best way to get vitamin D naturally is through sun exposure. Just 15 to 20 minutes of sunlight per day is enough to stimulate the body's production of this vitamin. However, many people are deficient in vitamin D, particularly those living in areas with limited sunlight. In such cases, supplementation may be necessary, but always under medical supervision. Foods like fatty fish, eggs, and mushrooms are also good sources of this vitamin and can help maintain adequate levels in the body. Now, let's talk about the third essential vitamin for diabetics, vitamin E. If you have diabetes, you've probably heard about the dangers of oxidative stress, a process that damages cells due to an excess of free radicals in the body. This stress can lead to serious complications like diabetic neuropathy, cardiovascular diseases, and insulin resistance. And this is where vitamin E comes in as a powerful ally. Known for its antioxidant properties, this vitamin protects cells from damage caused by free radicals, preventing severe diabetes complications. Moreover, vitamin E has a direct impact on blood circulation. People with diabetes are at greater risk of developing vascular issues like poor circulation, high cholesterol, and even thrombosis. Vitamin E helps improve blood flow, reducing plaque buildup in arteries and protecting the heart and blood vessels from hardening. Another incredible benefit of vitamin E is its influence on insulin sensitivity. Studies suggest that this vitamin can reduce insulin resistance, helping cells absorb glucose more efficiently. This means that, in addition to protecting the body from oxidative stress damage, vitamin E also directly contributes to controlling blood sugar levels. To ensure good intake of this vitamin, include foods like avocado, seeds, extra virgin olive oil, and nuts in your diet. In some cases, doctors may recommend supplements, but caution is needed, as excess vitamin E can cause unwanted side effects. These three vitamins are essential for any diabetic who wants to stay healthy, but there are still other vitamins and minerals that can make a big difference. In the next few minutes, we'll reveal other powerful supplements that can improve your body's response to insulin and prevent complications. Now that we've covered the first three essential vitamins, you're starting to see how much nutrition can influence diabetes control. But stay tuned, because the upcoming information might have an even greater impact on your health. Now that we've explored the first three essential vitamins for diabetics, it's time to dive even deeper into this topic. Did you know there are other vitamins and minerals that can significantly improve your health and diabetes management? If you truly want to understand how to keep your glucose balanced and avoid complications, stick with me, because there's still extremely important information that could change your life. The next vitamin on our list is vitamin B1, also known as thiamine. This vitamin plays a vital role in glucose metabolism and is one of the main allies in protecting nerves from diabetic neuropathy. Diabetic neuropathy is one of the most common and debilitating complications of diabetes. It occurs when high blood sugar levels start damaging nerves, causing symptoms like numbness, tingling, and intense pain, especially in the hands and feet. Over time, this issue can progress to complete loss of sensation, increasing the risk of wounds and infections that could even lead to amputation. But how can vitamin B1 help? This vitamin assists the body in converting carbohydrates into energy, preventing the buildup of toxic byproducts that can harm nerve cells. When levels of this vitamin are low, nerves become more vulnerable to damage from excess glucose, further increasing the risk of neurological complications. And here's something few people know. People with diabetes often have a vitamin B1 deficiency. This happens because the body eliminates this vitamin in much larger amounts due to high blood sugar levels. This means that even if you have a balanced diet, you might still be at risk of developing this deficiency. The good news is that supplementing with vitamin B1 can help prevent this damage and even improve neuropathy symptoms. There are two main forms of this vitamin, regular thiamine and benfotiamine, a more bioavailable and effective version for nerve protection. To ensure good intake of this vitamin, include lean meats, whole grains, legumes, and seeds in your diet. However, if you're already showing signs of neuropathy or a medical test detects a deficiency, supplementation might be essential to avoid more serious complications. Now, let's talk about a mineral that, while not a vitamin, is absolutely essential for diabetics: magnesium. Magnesium has a profound impact on blood glucose regulation and insulin sensitivity. Studies show that magnesium deficiency is directly linked to insulin resistance, a key feature of type 2 diabetes. But how does this work? Magnesium helps the body's cells use insulin more efficiently. This means that when there are adequate levels of this mineral in the body, glucose enters cells more easily, reducing its concentration in the bloodstream. On the other hand, when there's a magnesium deficiency, the body needs to produce more insulin to compensate for the cell's difficulty in absorbing glucose. This extra effort can overwork the pancreas and worsen diabetes over time. Additionally, magnesium plays a vital role in heart and blood vessel health. Diabetes is linked to a higher risk of hypertension, cardiovascular diseases, and even strokes. Magnesium helps relax blood vessels, lowering blood pressure and improving circulation. Another amazing benefit of magnesium is its impact on sleep quality and stress reduction. People with diabetes often suffer from sleep disorders and high stress levels, factors that can further destabilize blood sugar. Magnesium acts as a nervous system regulator, promoting relaxation and reducing levels of the stress hormone cortisol. If you want to boost your magnesium intake, include foods like spinach, almonds, pumpkin seeds, Brazil nuts, bananas, and avocados in your diet. However, many people don't reach optimal levels through diet alone, and in such cases, supplementation might be necessary. But beware. Always consult a healthcare professional before starting any supplementation. Now let's move on to another essential vitamin for diabetics: vitamin B6. Vitamin B6 is a key nutrient for nervous system health and glucose metabolism. It becomes even more important for diabetics dealing with neuropathy and chronic inflammation. Diabetic neuropathy is a painful and disabling condition, and vitamin B6 can help reduce the inflammation tied to this complication. Plus, this vitamin plays a crucial role in producing neurotransmitters like serotonin and dopamine, which directly influence mood and pain perception. Another surprising benefit of vitamin B6 is its effect on brain function. Research suggests that low levels of this vitamin are linked to a higher risk of cognitive decline, a concern for type 2 diabetics who already face an increased risk of neurodegenerative diseases. Additionally, this vitamin is vital for hemoglobin production, which carries oxygen in the blood. Since diabetics often deal with circulatory issues, ensuring good oxygen supply to tissues can prevent slow-healing wounds and more severe complications like diabetic foot. To get more vitamin B6, include lean meats, fish, bananas, potatoes, nuts, and seeds in your diet. If needed, supplementation may be recommended by a healthcare professional. Now, we've reached one of the most important vitamins for diabetics: vitamin B12. Vitamin B12 is essential for nerve health, playing a critical role in preventing diabetic neuropathy. If you experience tingling, numbness, or pain in your feet and hands, this might be the vitamin missing from your body. Moreover, vitamin B12 is crucial for producing myelin, the protective layer around nerves that allows proper signal transmission. When there's a B12 deficiency, myelin wears down, making nerves more vulnerable to damage, something extremely concerning for diabetics. Another significant benefit of vitamin B12 is its role in protecting the brain and preventing cognitive decline. Studies show that diabetics have a higher risk of developing Alzheimer's and other neurodegenerative diseases, and a B12 deficiency can worsen this issue even further. The richest sources of vitamin B12 include meat, eggs, dairy, and seafood. However, people following vegetarian or vegan diets need supplementation, as vitamin B12 isn't found in plant-based sources. Additionally, diabetics using metformin long-term may develop a deficiency in this vitamin, as the medication can interfere with its absorption. If you're on metformin, talk to your doctor about the need for supplementation. Finally, we have vitamin K2, a lesser-known but essential nutrient for diabetics. This vitamin prevents arterial calcification, protecting the heart and blood vessels, crucial for those with diabetes. It also works alongside vitamin D to ensure calcium is directed to the bones, preventing osteoporosis. If you want to improve your health, include these vitamins in your routine and always consult a professional before starting any supplementation. Don't forget to subscribe to the channel for more health tips. Watch the next video now to discover dangerous foods for diabetics.